finding a way to get Medicare
Good afternoon,
reimbursement.
and welcome to the Pennsylvania Press Club. I'm Joyce Davis, board member of the Pennsylvania Press Club, and your host for today's luncheon. Joining me at the head table is Anita Lewis, AmeriHealth Caritas, and Danielle Gross, ClearPoint Communications. Thank you for your support and thank you for being here. The Pennsylvania Press Club luncheon series could not be possible without the support of the generous organizations listed on the sponsor banner. Today's luncheon is being taped and will be carried throughout Pennsylvania to the television audience of PCN. Our speaker today was intended to be Secretary Val Arkoosh, but you know, it takes a special and most capable person to be able to step into the shoes, right, of the boss and fill them well. And I have had a chance to talk to Sarah Goulet, and she is the most dynamic person, so I'm sure we will definitely enjoy our luncheon presentation. Sarah Goulet joined the Department of Human Services as a special advisor to the Secretary in May 2021. Sarah leads DHS's maternal health innovation initiatives in DHS and in partnership with other Commonwealth agencies. The General Assembly and private sector stakeholders, combining her previous health and public safety experience to find ways to support all Pennsylvanians, but especially our most vulnerable. She also works on the state's integration of the 988 crisis response and initiatives to support parenting students as well. Ms. Goulet came to DHS after more than 4 years working in former Governor Tom Wolf's communications office. Prior to joining the governor's office, she served for 5 years as communications director press secretary for the Pennsylvania Department of Labor and Industry. Before joining state government, Ms. Goulet worked in corporate communications for the Hershey Company at various local advertising agencies and in her own public relations firm, Goulet Communications. So I know I'm very excited to hear what Ms. Goulet has to say, and we thank her very much for stepping in to fill some big shoes.
Good afternoon. No pressure or anything, right? It's fine. No, I am happy to be here, and I totally forgot your name, but that's a great start. As Joyce said, I am Sarah Goulet, and I'm a senior advisor to Val Arkoosh, and on behalf of Val, I want to thank you for having me here today, and I do apologize that she was unable to be here. I feel a little bit like someone who made a pilgrimage to their favorite major league ballpark, and then their starting pitcher was on the injured list when you got there, and you're like, oh, well, I'm here now, I'll stay. So hopefully nobody walks out the door. But anyway, I really am happy to be here and talk to you a little bit through some of the work happening at DHS currently and where we are looking to move our human services work under Secretary Arkoosh's leadership. First, I'd like to start off with a brief story that if you've heard Secretary Arkoosh speak previously, you may have heard before, as she credits it for her move from practicing medicine to public health and public service. But I think it summarizes the perspective that guides our work at the state level and that we encourage our partners across this vast service system to consider. It's a story of 3 friends walking in the woods. They approach a stream and hear children screaming. As they get to the water side, they see children trapped in the water approaching an upcoming waterfall. One of the friends jumps into the water and swims out to the kids, trying to grab them one at a time and getting them back to shore. The second friend pauses to tie 2 logs together to make a small raft, then swims out to the kids, and after a while brings back, a few children there. And after a period of time with this system in place, the number of children in the water slowly trickles to a stop. The 2 friends look up and realize that their third friend was missing. A few minutes later, that friend comes walking back down the riverbank. And they're annoyed, obviously, and they're like, where were you? And the friend says, well, I walked upstream to see where these kids were falling into the water in the first place and to see if I could stop it. When we think of problem solving, we're often taught to jump in the metaphorical river or maybe build the raft to address the most urgent need. And those skills do remain very important. Sometimes before we can get ahead, we have to focus on the crisis in front of us to get through that very moment. Some of you may have been taught or experienced this way of problem solving as well. And that can be important, but we can't stop there, or we'll find ourselves in that situation again and again and again. More and more, we're starting to look upstream. That's where we have the most opportunity to learn, and that's where voices, experiences, and advocacy can make a difference. We must meet people where they are and address their most urgent needs. That's a core responsibility of the Department of Human Services as an agency, and it's not something that we will stray from. But our work cannot stop there. DHS is a vast agency spanning healthcare, public assistance, long-term care, child welfare, disability services, mental health, service licensing, and so much more. We serve more than 3.6 million people directly through programs like Medicaid, the Supplemental Nutrition Assistance Program, and other public service programs, as well as countless others through our licensing, oversight, and protective services. This gives us myriad opportunities to look beyond the immediate need and a responsibility to use this work to make broader, community-level change that can improve health and circumstances, both through a person's life and hopefully across generations. Poverty and the disparities it creates are complex, and they don't happen overnight. These solutions will take time, but we need to look longer term if we're going to make change. One area of focus on this is our maternal health innovation work, an effort I coordinate here at DHS and I'm really proud of, as well as in partnership with other state agencies, with members of the General Assembly, many maternity health advocates, and other partners. We've probably all read stories, and we know the statistics are devastating. Black people are 3 times more likely than white people to die from complications related to childbirth in the United States. In Philadelphia, Black people represent 73% of pregnancy-related deaths, but only 43% of births, according to the most recent data we have, which is the 2018 Philadelphia Maternity Mortality Review Committee. And based on a recent March of Dimes report that rates the state of maternal and infant health, Pennsylvania is graded as C, and Philadelphia is graded an F. This is unacceptable, and our communities, our mothers, and birthing people deserve much better. Last year, Pennsylvania was able to expand the Medicaid coverage period for new moms to 1 year after giving birth. So it was initially offered as a 5-year pilot under the American Rescue Plan Act, but the Consolidated Appropriations Act of 2023 passed late last year and made this option permanent, which is very exciting. We know that most maternal health deaths occur post 6 weeks. So if you were only covered till 60 days past your birth date or the birth, you're not covered certainly as long as you need to be. So the extension of postpartum Medicaid coverage for moms and birthing people eligible because of their pregnancy will help them continue to access physical and behavioral health, incredibly important, that's necessary to keep themselves healthy and their families on a path to good health and well-being. We can't separate the health of the mom from the health of the child. And Human Services, we're rewarding our managed care organizations that are introducing innovative approaches to support perinatal and postpartum maternal health and at-risk moms. And we're taking those successes to other MCOs. Really good to have a collaborative approach. And we're working to compile a list of MCO innovations that OMAP, which is our Office of Medical Assistance Programs, will be sharing. Here's some highlights, though. Most have managed care programs that take a full spectrum look at maternity care. Some offer diaper programs. Some offer mobile care management programs out in the community, which is so important, especially when there are some maternity care deserts. Out in the community to look at needs and provide solutions that are specific to that community. So every community is different. We have a big, diverse state. Some are identifying disease-specific high-risk moms and providing things such as at-home monitoring for like blood pressure cuffs. If someone can check their blood pressure daily and then submit that information onto an app, they can get care much more quickly if there's a situation that requires that. And where there are maternity care deserts, we're working with the Department of Health to find solutions and working with hospitals that are reducing maternal health services to ensure those women and families affected can receive high-quality care without barriers. We understand the systemic racism involved in the distrust of our healthcare system. Yet we don't know everything, and we need to remain cognizant of that. Practicing cultural humility, so cultural humility, basically saying we don't know everything, right? And remembering that we need to ask people that we serve what they need. Providing equitable, whole person care means listening to what people need and understanding the reasons why Black women distrust the healthcare system, looking to trusted messengers, and considering the health-related social needs of those we serve. We know that transgender, non-binary, and gender non-conforming individuals often face discrimination in healthcare settings. Research shows that many are unable to find competent, knowledgeable, and culturally appropriate healthcare. We need to support and increase the BIPOC workforce in healthcare at all levels, including policy. Consider establishing apprenticeships for doulas and community health workers, and training programs that allow people to earn while they learn. We also must ensure that all involved state agencies have their own goals to support maternal health, from adolescents to older adults. I know that I speak for Secretary Arkush when I say that we are eager to get out into our communities, working hand in hand with our sibling agencies, Health, Aging, the Department of Drug and Alcohol programs, to learn what women and families need, how we can best help them, what's working, rewarding our providers that are listening, and focusing on the unique needs of women and color and people in underserved communities. We need to replicate programs that are working and engage in thoughtful research using data to help inform policy. This is a space where we must do more, and we have the opportunity to make a multi-generation impact. A mom's health greatly impacts their child's health. We can and we must do more. And here and beyond maternal health, Secretary Arkush has directed our team to think creatively on how we can better leverage Medicaid to address things like housing, food and nutrition, and other essential needs that shape our health and well-being, often called social determinants of health or health-related social needs. More to come on that in the future, but as I mentioned previously, while we look towards the future, we can't lose sight of the urgent challenges we face. You will probably have heard that the pandemic policies are recently ending, right? And that's kept most people, they had kept most people enrolled in Medicaid for much of the past 3 years. If you're not familiar with what has been called Medicaid unwinding, let me give you some background. Since March 2020, federal pandemic response policies allowed states to keep most people who receive their health coverage through the state enrolled in that coverage, even if they were no longer eligible or if they did not complete an annual renewal. However, these rules ended earlier this spring, and Pennsylvania has returned to pre-pandemic processes for determining Medicaid eligibility. What this means is that people who get health coverage through Medicaid must complete their annual renewal when it's time to renew. It's not always at the same time, or they risk a gap or a loss of coverage. Now, Pennsylvania, unlike some other states, had never stopped sending out renewal packets, but for some, it may be the first time or in a few years that they're going through the actual renewal process with the potential for disenrollment. It's a big change with the potential for big ramifications if not done carefully, and we want Pennsylvanians to be ready so that they can stay covered. No one's health coverage stopped automatically because of this change. I'll reiterate that. No one's stopping automatically. All Pennsylvanians covered by Medicaid and CHIP, which is the Children's Health Insurance Program. Everybody probably knows that, but I'm going to say it again. They'll have a chance to complete a renewal or update their information over the next year. And I can't stress enough how important completing this renewal is. Coverage will only end if a person becomes ineligible or if they do not return their renewal. And renewals go out throughout the year, and renewal dates are unique to each person. So we need Pennsylvanians to be ready for their renewal so they can stay covered. By completing the renewal, we can make a seamless, direct handoff to Penny, Pennsylvania's health insurance marketplace, or CHIP if a person no longer qualifies for Medicaid. As we work through the critical period for Medicaid enrollees, health centers are an important resource for people who need to renew their coverage. So things like our community health and our federally qualified health centers are great partners. So we're just starting to have enough data trends for the unwinding moving forward, but we've been closely monitoring the renewal process very, very closely. And based on data from June, our last full month of available data, although July will be finalized soon. Nearly 282,000 Pennsylvanians have completed their renewals and maintained coverage, which is good news. More than half of cases that had to be closed were due to ineligibility. And at this point, Pennsylvania is among the states with the lowest rate of procedural terminations, meaning people who didn't return their renewal at all, just people that we never heard from. This is something we're watching closely because while some level of churn was normal before the pandemic, we want to keep our procedural termination numbers as low as possible so people are either maintaining Medicaid coverage or getting that direct handoff to Penny to purchase new low-cost coverage. At this point, processes are moving according to plan and consistent with normal operations. And our call centers, which would be our county assistance offices and other call centers, I think we have other call centers, yeah, we do, okay, are performing within range of what we would expect. And we're continuing to hire staff to ensure those centers are fully staffed and able to help as quickly as possible. Since April 1st, more than 10,000 has successfully enrolled into new coverage through Penny, and Penny is the state-based exchange. We have not experienced any unusually prominent complaints about misunderstanding how or where to complete renewals to date. And anecdotally, we've heard from staff at our county assistance offices that the process is going smoother on their end than they thought it may. Return mail is lower than anticipated, so we're hopeful that messages about updating contact information are getting through. And we've been at this for well more than a year, right, planning what we need to do, because you may recall, like, there was potentially going to be an end to the public health emergency, then it wasn't, then it was extended. So very much like planning well in advance and reminding people even way back when, if you will, to like get their contact information updated, because that was the most important thing, that when they were going to start to get a renewal package, they needed to have their contact information accurate. But we'll continue to monitor incoming recipient feedback and look for data trends to make sure we're getting our targeting our outreach appropriately. And on the topic of outreach, I wanted to briefly highlight some things we're doing at the state level before I hear your questions in the long run. So what we're doing is, first of all, we're increasing direct outreach to Medicaid enrollees ahead of renewals by implementing additional phone calls, text messages, and email outreach through various points of the renewal process. Holding press events with community partners, including a number of health centers who have hosted us, to raise awareness of unwinding and what people need to do to stay covered. Leveraging a partnership with the grassroots outreach partners to hold events in grocery stores, bodegas, faith centers, cultural festivals, and more in high Medicaid density communities around Pennsylvania, as well as with trusted messengers. Running a long-term paid media campaign and partnering with Penny to co-brand ads through their media efforts. And working across state agencies to continue to grow our network of partners, advocates, and stakeholders to assist with outreach and reach more Pennsylvanians. I cannot underestimate how important this effort is to Secretary Arkush and all of us in leadership at DHS and the Shapiro administration, so this must and will continue to be our top priority over the next year. This is a significant challenge to our agency. We do not want this return to normal to mean a significant loss of coverage for Pennsylvanians. So we appreciate any partnership and opportunities to get the word out. If you'd like to learn more about renewals or look for some other information, we have a hub of information on dhs.pa.gov/staycovered. And you'll find information about this process, a timeline of communication that people will receive when it's their turn to review their renewal, a communications toolkit, and much more. So thank you again for this opportunity to join you and discuss some of DHS's and Secretary Arkush's areas of focus. Thank you for being patient with me here as a substitute, or the bullpen pitcher, whatever you want to call me. But we do look forward to continuing to work with you all, and I'm happy to take questions with the time we have left.
Thank you, Ms. Goulet. I do have some questions for you, and the first one actually asks you to do what you've already done, which is give us an update on the unwinding of Medicaid, but they did have a question here that I don't think you touched on. They want to know how many people actually have lost coverage due to the process. Has any? I thought you may have said nobody,
Sure.
But go ahead.
No. Okay, I can probably tell you that. Hang on. Obviously, we don't want anybody to lose their coverage, but there will be circumstances where someone may. So we know if they don't complete that. Don't mind me referencing my notes. I don't think we have it on there. We would have it on our dashboard, though. We have a dashboard now that really goes by county, which is really an interesting resource, too, and that's on our DHS, the state covered page that I mentioned, dhs.pa.gov/state covered. And we're doing our best to update that as quickly as we can, so it's kind of real time, and it will be more and more like that over time. And you can look on there, even by county, to see sort of what the situation is in terms of renewals and those who may not or have lost coverage.
You want to give them, is it just DHS?
.pa.gov and then /state covered.
Okay.
Yeah,
state
that's
covered.
really the best place to look at that dashboard, because that's really a resource for everyone to see. And if you see like a particular county that you're in or that you serve, the numbers, looks like we might need a little more help, and that's why we're here to reach out to us and see what we can do to help you potentially within that county. If it's a text message campaign or some other way that we can help, we're happy to do that. Again, that's why that dashboard is public, and we would encourage you to take a look at that.
Okay. This question says the state agency is dependent upon service providers to actually deliver human services. And of course, oversight and inspections are critical quality assurance steps. Many providers report bureaucratic overreach and even abuse of providers. So how does the agency build a collaborative relationship with providers?
Wow. Okay.
Tough question.
That's a good question.
I only read it.
I'll reiterate again how partnerships are incredibly important and collaborations are incredibly important for Val, as for all our deputy secretaries in our department. And so, and I think being responsive to those needs are something that we're aware of and focusing on, and always taking a look at our licensing. How can we do that better for everyone involved, for providers as well as those people that we serve and protect? So I think really just looking to continue collaboration is what we want to do, and kind of how we tend to operate. So I hope that kind of answers that.
You also mentioned the lack of trust, particularly among some community, Black women for one, but I would say
Sure.
Black men for sure. But so I wonder, are there any ongoing efforts to kind of build that trust before you really need to have it there?
In all circumstances, Joyce? Yeah, I mean, absolutely. I think that's where kind of building upon that, finding out what people need, not building programs and pushing people into them, but like working with people to develop the programs they need and find out what they do need is super important, because I think that builds trust, right? It's not just like, here's a program, okay, I hope it works out for you. I mean, it's really like talking to the audiences that we serve and trying to find out what they do need. And if we have a program that's working to a certain extent, how can it be better? So I think those are all things that we absolutely want to continue to do and are doing even more of. As I mentioned, like Val is already out in the community. The message that I delivered today on the unwinding is an incredibly important one, and that's getting around to communities to also learn more about what's happening in the communities. It's not just to deliver that message, but it's also to learn a lot more about what's needed. So, and I know she'll be doing even more of that.
Okay. This question says, can you please discuss the real-time, on-the-ground experience providers are having now that the nursing home staff ratio mandate has gone into effect? DHSs and providers, yeah.
That is not something that unfortunately I could explain, but I will be happy to find that out for you. I wish that I knew everything about DHS, the largest agency in the state, but I don't. So
Okay.
again.
I will put this one
Yeah,
here
yeah.
for you.
Share that with me.
Give
Yeah,
it to you.
and again,
Okay.
I will be happy to get back on that.
All right, all right. There's a question here that says, why did Governor Shapiro allow for $100 million to be directed away from adult mental health as part of the budget agreement? When county, various stakeholders, and more than 170 members at the PA home supported it. Okay, so you get the gist.
I would
what's
let
the-
Governor Shapiro office answer that.
Okay,
I would feel more
very good.
comfortable with that.
So there's a question about medical assistance. It seems like they are saying it severely limited the adult dental benefit to extractions and cleansing, but no procedures to save teeth. Can you comment in any way on?
I can only comment to say
Okay.
there are definitely ongoing conversations around
Okay.
dental benefits. Well aware of those, and there's been multiple conversations taking place at DHS.
Excellent. Okay, so There's a question here again, but how will the Shapiro administration fund the county, it looks like MD programs? I'm not sure if it's MB or mental health programs. It's not confusing, so
Could be mental health.
maybe so, well.
Again, yeah, I would
Okay.
either address that at a
What
later date,
is-
percentage to Governor Shapiro's office too.
What is the ongoing relationship with the Senate following the nomination process where no vote was taken?
Well, we're very pleased that Secretary Arkush was confirmed, first of all. Very excited to have her on board. She's great. And we're continuing any conversations. I know Val is completely open to speaking with anybody, and and we were just talking about that. Anita and I were talking about that before too. So happy to continue conversations with the Senate. Any in particular senators that have questions? I mean, Val's door is pretty much open, even though obviously her schedule is incredibly busy, but always happy to continue those talks.
I think I went through most of the question, but I just had one concluding one. It may be tough too, so forgive me, right? Sure. But no, I wondered as you were talking too about the AI, and are you guys preparing to utilize it or to be prepared for the challenges that it may present to your department? So talk a little about that.
Yeah, that's a good question. I mean, I can't say if we've had any specific conversations about AI and its uses or not. I mean, I certainly have seen the Biden administration start to take a look at some, even working with AI, like the big tech people in AI saying, we understand that we need to be like a little cautious about its use, which I think is good to hear. And I would think we would approach it cautiously as well, but I can't say that we've started any conversations. But in a way, yeah, you can look at it as it sounds incredible and could be helpful, but it also sounds pretty scary. So I think you have to tread lightly.
But is there an actual task force or anybody looking at
That
this?
I don't know. If there may be out of the governor's office, but not specifically at DHS at this point that I'm aware of.
Okay, put a bug in there. Okay.
I'll do that.
Another question. Can you share more about the outcomes from your maternal health work?
Well, we're gearing up a lot on maternal health. Let me give you a couple of highlights. A few things that we've done that I think are making a difference and hopefully are going to be just small steps towards a much bigger approach to maternal health is we started a doula program in our state correctional institution at Muncie, which is near Williamsport, about a year or so ago. It actually started in January of last year, where we provide a doula to any pregnant inmate who would like one. We work with a doula out of Williamsport, who's awesome. She comes into the prison and works with the moms there and goes with them when they give birth, and then stays with them regardless of whether or not they're incarcerated or they're returned to their community for a year post-birth, just like any other Medicaid recipient, although Medicaid inmates do not get Medicaid. So we were able to get private funding for that. And then the Women's Health Caucus, through some legislative funding, we're continuing that program at SCI Muncie, as well as adding it into Cambridge Springs. We were able to open a lactation room at SCI Muncie, so moms who go back, their babies are cared for by a family member or another. Typically it's been family members, which is great, but anyway, so the moms can pump breast milk and that can be shipped to the baby, which is a really great way to help them with their mental health and to help with the health of the baby. So, but in addition to that, we really took a look at, and I think this is sort of a kind of a summary of like how we really are approaching mental health. We looked at the children and the caregivers too. So it's not just the mom and the needs of the mom, which the doula is meeting, as well as parenting classes the Department of Corrections hosts. But we're looking at the children, so whether it's the baby who's born or other children are being cared for, and the caregiver, and saying, well, what do they need now that their mom is incarcerated? So it's early intervention, it's WIC, it's SNAP, it's ways that we can work with that family to look at that kind of dyadic approach, if you will, and even kind of beyond that, to make sure that we're doing everything we can with a pretty small percentage of people, right? But to make a difference and to hope that we're changing some of the trajectory potentially of those children as well as the mom. We've had some of the women who went through the doula program say they want to become doulas now when they get back into their community. So kind of a cool thing, and that's a testament to the great work of our doula, whose name is Juria Coffey. She's incredible. So anyway, that's, I think, because we're saying, like, we got to get out, we got to talk to people. What do they need? What can we do to provide that? What are the barriers to the care that they need? And how do we fashion those programs? And that's really what we're looking to do as we begin sort of a journey towards a stronger kind of statewide plan around maternal health. We kind of know what the problems are, but we don't necessarily know the best way to solve those until we talk to more people about it, right? So I think very excited to take on that work. It's going to be big work. And, we will work with our sister health agencies as well as the governor's office on that work. A lot of stakeholders, a lot of people with lived experiences, ways that we can learn what we don't know, and how we can really tailor programs to communities for what's needed in those communities.
Okay. I think we have time for 2 more questions, right? Or we have some more coming in, but okay, here's one. How are you going to help transgender folks get proper gender-affirming care? What are some changes you are trying to bring to this cause, and how will you implement them?
Okay, I cannot say specifically other than what I mentioned in here, which is very much support of making sure that all people, all vulnerable populations have access to the care that they need.
Okay. As social service providers, we find ourselves helping so many of the same clients purely due to the intersectionality of poverty-related issues. Are there any discussions at DHS about creating a more collaborative system of supporting clients or a way to have a robust system of provider information?
Ooh. So yes, I mean, I would say when we talk about health-related social needs and we talk about poverty as something that doesn't happen quickly, I mean, and it's something that we really have to find our way out of. So I think, again, I'll just say that our desire to be collaborative continues with our providers, with our stakeholders, with advocates, with the people that we serve. So suggestions on that from our providers or whomever that we work with are always welcome, and ways to do that better. But we very much are open and willing and eager to do that.
And here's one I think will resonate with a lot of people. How is the department addressing the rising cost of health care and ongoing increases to medical debt?
Yeah, that's boy, if only we could solve that, right? That'd be great. Well, I do think, I don't think we alone can solve that. I mean, I think when you speak of partnerships and collaboration, it's really important that we do that with our healthcare systems, our MCOs, all providers. I do know that we're, with the Medicaid unwinding and working to make sure that people stay covered if they can't be covered through Medicaid, being able to go to Penny, where you can get a plan for $5, $10 a month in some instances, is a pretty incredible way for people to remain covered. And I think the more that we lead people to preventive services and the things that are available to them, that can help ultimately with healthcare costs, and that's something important to do. Help people be healthier in the first place, and then not need so much in the long run potentially. But that, yeah, it's a big job, and I think that there's going to have to be a lot of audiences and folks working together for that to be solved.
Well, thank you very much. I think we've grilled you long enough. So please join me in thanking Sarah Goulet. Yeah. Actually, I think you did a fine job, but yeah, under the circumstances. So we do have some mementos for Ms. Goulet. These are compliments of PCN and the Pennsylvania Press Club. So we will be giving those to thank you. In closing, we want to thank each one of you for being with us. Our next luncheon is Monday, August 28th, when our guest will be Pennsylvania House Majority Leader Matt Bradford. For scheduling information and to find out about everything else about this organization, you can visit our website at www.papressclub.org. Thank you again for being here. Have a great day.